The patient reluctance to get colon cancer screening is a major issue, and it's a major problem and detriment in terms of our efforts to screen the population, which is really our edict.
Well, I think people feel that it's an uncomfortable procedure, and they'd rather avoid it than talk about it.
It's a section of your body that you really don't talk about a lot, and I think it's just sort of an uncomfortable test. At least people think it is, and it's not. If you've never had a family member who has had the test or a family member who has had colon cancer, you're clueless, so you sort of just don't bother with it.
And that type of avoidance for something that is so curable and so preventable is something that we're really working against, and we're trying to reassure patients that colon cancer screening is A, easy to do, B, easy to get, and C, very important for them to get as well.
Some people may have the misconception that they're going to be admitted to the hospital and have to be under a doctor's care simply because of some of the steps that are taken, but it is just a test. I mean, you do have to put on a hospital gown and all the particulars that come along with it, but it doesn't take all day, and you're in and you're out, just like going in, taking an x-ray, and you're done.
Colon cancer screening saves lives, and with colon cancer screening, we're looking for polyps. So these polyps are the precursors to colon cancer. If found, detected, and removed, they eliminate the possibility of developing colon cancer. In the National Capital Area, we presently are screening about 30% of our eligible beneficiaries. That's a rather low number.
Anybody who is active duty or retired and eligible for health care, we want to be able to screen that population. So we're trying to be very proactive and get ahead of the game, and we can do that in 90% of the cases.
Colon cancer is definitely a preventable disease. It's the second leading cause of cancer death in the United States, and by removing those polyps that lead to cancer, we know we decrease the risk of cancer development.
If I had not gone for this test, I could have had a full-blown cancer that could have gotten out of control long before I had seen a doctor, because I wasn't having any kind of pain.
People don't normally find colon cancer until it's too late because there are no symptoms, and so we need to screen them when they are asymptomatic or have no symptoms so we can find those polyps. By the time you get any symptoms, it's usually too late. It's a full-blown colon cancer. If somebody wants to have a colonoscopy, they will call the colon cancer screening line. The nurse would take a little bit of history, and then they would go on to explain the different methods of screening that are available and help the patient decide as a joint decision what is the best test for them.
Everything was on schedule. There were no delays, and basically I went in there, got out, did the procedure, and got out quickly.
With the virtual colonoscopy or CT colonography technique, which involves scanning a patient through a CT scanner, building a three-dimensional model of the colon, and then virtually flying through that model, looking for polyps and cancers, we can reach a significantly larger percentage of patients. Our virtual colonoscopy does not require sedation and is done just simply with a CT scanner and a CT tech.
Having the knowledge of what's going on with your body and knowing that catching things early that could be a problem later on down the road could possibly save your life.
In this day and age, I think we all should be taking advantage of medical technology, and it's foolish not to, because it saves your life or the life of a loved one, and you should be encouraging people to be taking it, not just yourself.
It's a no-brainer for me, to tell you the truth. You go in, you have the procedure. If there's a problem, they fix the problem, and you don't have it anymore.